Hello, it's Dr. David Green, founder and CEO of R3 Stem Cell International. Today we're discussing stem cell therapy for chronic liver failure in the Philippines. So first let's discuss what exactly does the liver do for us? Well, a lot of things as it turns out. It produces bile and excretes it. It excretes bilirubin, cholesterol, hormones. Quite a few drugs are excreted through the liver metabolism. Metabolizes fats, proteins, carbohydrates. It does activate a significant amount of enzymes, and it has a storage function for glycogen, vitamins, and minerals. It puts together plasma proteins, such as those necessary for clotting, and it detoxifies and purifies our blood. So what are the reasons for a liver to fail over time? Various infections, such as hepatitis A, B, and C, can cause a liver to fail. Immune system issues, such as hepatitis, primary biliary cholangitis, or sclerosing cholangitis. There's various genetic issues, such as Wilson's disease, hemochromatosis, antitrypsin deficiency. Cancer can lead to failure, and then other, most prominent of which is alcohol abuse. So when you look at the progression of liver disease, it typically starts with inflammation. It leads to fibrosis, which is scarring, which then leads to cirrhosis, and then end-stage liver failure is the cycle. So what are the risk factors? Well, heavy alcohol abuse is definitely number one. Obesity or type 2 diabetes, various tattoos or body piercings, those pretty much can just lead to hepatitis, which can then lead to liver failure. Drug abuse with injections, once again, that can lead to hepatitis. Blood transfusions before 1992, before they tested for hepatitis. Exposure to other people's blood or bodily fluids, unprotected sex, exposure to certain chemicals or toxins, or a family history. The traditional treatments for liver failure are not fantastic. There are some medications, such as diuretic or blood pressure medications, which may help a bit. Lifestyle changes, including weight loss or obviously stopping alcohol if that's the inciting issue, and then various supportive cares, and then a liver transplant. There is no form of dialysis for the liver like there is for the kidney. So the liver is our only organ that can actually regenerate. It's the heaviest organ in the body. It can actually you can remove 70% of a person's liver, and the rest will regenerate the organ. We don't do that with any other organ in the body. Now, liver transplant is not super common in the Philippines, although it's getting more common. The National Kidney Transplant Institute doesn't just focus on kidneys, they do liver as well. There is a 1-year survival rate of 85%. They have seen some long-term survival of 15 to 20 years as well. 16,000 Filipinos die annually due to cirrhosis, most commonly due to Hep B or alcohol consumption. So let's start talking about stem cell options for liver failure. So this study showed human mesenchymal stem cell transfusion is safe and improves liver function in acute on chronic liver failure. This was a 2012 study out of China. Included 43 liver failure patients, 24 of which received the umbilical cord mesenchymal stem cells, which is exactly what we use for treatment. They gave 500,000 stem cells per kilogram 3 times once a month, so over 3 months. 500,000 per kilogram, let's think about that for a second. If you weigh 80 kilograms, that means you would get 40 million stem cells. So significant numbers. The ones who received the transfusion had increased survival rates. They also showed increased albumin, cholesterolerase, and prothrombin activity, and a higher number of platelets. So it worked really well. They did decrease the bilirubin and alanine aminotransferase levels. The end result is that it was shown to be safe and should be a novel therapeutic approach for hepatitis B associated liver failure. Here's a study that was actually a review article, and what they did was they showed that in lots of studies, stem cells improve liver function and have beneficial effects. But what it did note is that we don't understand why, and that's there's quite a few drugs on the market that for various conditions that we don't know exactly how they work. We just know that they work well and they're safe. So that falls into this category. And we know quite a bit of what they do: form new blood vessels. They decrease inflammation. They can increase cell-to-cell interactions where those cells then repair and regenerate themselves. But to get really specific about it, we're not there yet. So here's a chart of a large number of stem cell studies on liver failure, either looking at umbilical or bone marrow derived stem cells. And you can see in the column of the injection route, some put them into the spleen, hepatic artery, portal vein, or just a peripheral IV, just in the arm. That's what we do, and you can see the results was very good, actually. Okay, that's what this means. There were minimal side effects. I said none in actually all these studies. And when you look at the amounts of stem cells that they gave, it was actually very high. So this was 30 to 50 million. This was 500,000 per kilogram. 10 million. So 20 million. Here's a study looking at mesenchymal stem cells for fibrosis. They looked at the anti-scarring activities were significant. Antioxidant activities were significant. There were a lot of growth factors secreted by the mesenchymal stem cells. They do have huge immunomodulatory potential, which can protect the liver from getting damaged by faulty immune system processes. Here is another chart of some clinical trials in treating chronic liver diseases with stem cells. Some had many as low as 4 patients. This one had 53 patients. So this one with the umbilical cord showed improvements in the MELD score. This was out of China. They all had improvements in MELD score. So these were all significant. Stem cell transplant for advanced stage liver disorders. This was a meta-analysis which looked at hundreds of studies pulled together to analyze the results. They showed significant improvements in patients with chronic liver disease. The studies clearly indicated that stem cells played a key role in protecting the liver by anti-inflammatory, autoimmune suppression, angiogenesis, which is blood vessel formation, and anti-apoptosis, which is preventing cell death. So if you can create more cells and also stop the good cells from dying, that can be very beneficial for liver function. So in conclusion, after all those studies, many of which are small, some of which were large, some of which were early clinical trials, if you put that together with our own experience, it shows that stem cell therapy for liver failure is very, very safe, and it's typically very effective. We know that high stem cell numbers are necessary. We do offer those high stem cell numbers with our treatments in a very cost-effective manner. You don't need to inject into the hepatic vein or the liver itself. We do it much more safe in an IV treatment. The cells will go to the liver. It's inflamed. That's what attracts those cells. So they go to where they're needed. So just a note, we don't use embryonic stem cells. Those are the ones that come from aborted fetuses. They are problematic in that they can cause a rejection reaction or tumors, or both. So we've never used those. They're not ready for prime time. Neither are the induced pluripotent stem cells. We use umbilical cord derived mesenchymal stem cells and stem cell exosomes. So they're very ethically derived, high quality standards, using FDA standards. So if anyone suggests that you should get an embryonic stem cell treatment, run away. So our international treatment program in the Philippines is very similar to the other 7 countries that we're in. We perform the treatments in Manila. The process starts with a free phone consultation with one of our licensed, experienced stem cell doctors. We do have patient concierge representatives who will assist you with all your travel logistics if you're coming from out of the country. If you're local, you could just drive to our clinic, but we do have that available. Now, our cells are very high quality, better than any in the world. We have umbilical cord stem cell tissue from the United States with a pristine safety record. We've never had a significant adverse event in over 17,000 cases. We do process our tissue with FDA quality assurance standards. These are pure, potent stem cells with growth factors, exosomes, cytokines, secretomes, microRNA. I call it an orchestra of regenerative elements coming together to help you get better. So getting the process started with us is very simple. If you give us a call on our USA line at 888-988-0515, you can also visit us online and contact us there at r3stemcell.com/Philippines. We've been around a long time, 10 years now. We've won many awards. We've treated many patients successfully. Our success rate is over 85% overall. Like I said, we're in 8 countries now, and we're the largest and best stem cell provider and the most cost-effective in the world. All right, thank you very much for watching.